Let's talk about 5 medications that are commonly prescribed but are generally avoided by doctors for long-term use. It's no secret that medications can be life-changing when used appropriately. They bring much-needed relief, especially when symptoms are severe. But when these are used for extended periods without addressing the root cause of the issue, they can sometimes raise concerns. Long-term medication use often signals a chronic problem. And while managing symptoms is important, it's equally vital to dig deeper and understand what's causing them. Simply masking the problem without tackling its source might not lead to the best outcomes. Today, we'll highlight 5 types of medications that fall into this category, ones that many healthcare professionals approach with caution when it comes to prolonged use. Our goal is to provide you with insight that helps you stay informed and engaged in your health decisions. As always, we'd love for you to join the conversation. If you find value in what we share, don't forget to subscribe, like, and pass this video along to family or friends who might benefit. And be sure to share your thoughts or experiences in the comments. We learn so much from you all. All right, let's dive in. Number 1 on our list, let's talk about NSAIDs, painkillers with a catch. All right, first up, painkillers, specifically NSAIDs or non-steroidal anti-inflammatory drugs. These are some of the most commonly used medications worldwide. Names like ibuprofen, Voltaren, diclofenac, and Loxonin, loxaprofen might ring a bell. Some are even available over the counter, making them super convenient for quick relief. But here's the catch. There's more to these drugs than meets the eye. While they're great at tackling pain and inflammation, prolonged use comes with risks. Let's break it down. 1. Heart health. Studies have shown that long-term NSAID use can raise the risk of heart failure by about 20%. And guess what? The risk climbs higher with larger doses or extended use. It's one of those the more, the worse situations. 2. Gut troubles. NSAIDs can wreak havoc on your digestive system. We're talking about ulcers, bleeding in the stomach, and in severe cases, perforations in the stomach or intestines. Not fun. In fact, most bleeding ulcers are tied to extended NSAID use. 3. Kidney concerns. These painkillers can also affect kidney function. Reduced kidney performance can lead to fluid retention and swelling. Here's the kicker. While only around 5% of people show noticeable swelling, kidney strain is something no one wants. 4. Other side effects. There's more. Long-term NSAID use may cause dizziness, headaches, or even allergies. For some, allergic reactions can be severe. Think skin rashes, breathing difficulties, and facial swelling. Scary, right? Here's the bottom line. NSAIDs offer temporary relief but don't address the root cause of pain. Whether it's an aching knee, a sore back, or something else, these meds won't fix the underlying issue. Then, what can we do instead? The good news? There are safer, more natural ways to manage pain. Here are a few ideas. Relaxation techniques. Deep breathing, meditation, or gentle stretching can work wonders. Low-impact exercise. Activities like swimming or yoga strengthen muscles and reduce strain on joints. Physical therapy and acupuncture. These can be game changers for targeting specific pain points. Lifestyle tweaks. Maintaining good posture, staying active, and keeping a healthy weight can prevent pain before it starts. Of course, there are times when NSAIDs are necessary, acute pain, for example. In those cases, follow medical advice carefully. Stick to the recommended dose and avoid long-term use unless prescribed. Painkillers like NSAIDs are effective, but come with strings attached. By being mindful of their risks and exploring alternative pain management strategies, we can take better care of our bodies for the long haul. Always consult with a healthcare provider to tackle the root cause of pain and make the best choices for your health. Number 2, statins, a thoughtful approach to cholesterol-lowering medications. Let's talk about statins, a medication many of us have heard about or maybe even considered. They're among the most commonly prescribed drugs for lowering cholesterol, celebrated for their role in reducing the risk of heart disease. Discovered by Dr. Akira Endo, a Japanese scientist, statins are often described as a groundbreaking achievement in modern medicine. But like everything in healthcare, the benefits come with a bigger picture to consider. Statins are proven to lower the risk of heart disease by 30 to 40% in some studies. That statistic is eye-catching, but let's break it down. In a significant study, 3% of participants who didn't use statins experienced heart attacks. Among those who took them, the number dropped to 2%. While this is presented as a 30% relative reduction, the absolute difference is just 1%. In real terms, preventing one heart attack might require dozens or even hundreds of people to take the drug without seeing direct benefits themselves. Now, let's explore the risks. One potential issue with statins is muscle damage, a condition known as rhabdomyolysis. This can cause muscle pain, weakness, and even long-term complications. There's also mitochondrial dysfunction to consider, which affects the energy production within our cells. Even more concerning, studies suggest statins may raise the risk of hemorrhagic stroke. These are serious side effects that can't be ignored, especially for those whose only concern is high cholesterol without additional risk factors. Please follow your doctor's prescription. Educate yourself about the medication, including its benefits and potential risks. Discuss any concerns with your doctor to ensure you're confident in your treatment plan. For right dosage, always take statins exactly as prescribed. Your doctor will determine the appropriate dosage based on your cholesterol levels, age, health conditions, and risk factors for heart disease. And also the timing. Some statins work better when taken in the evening, like simvastatin and lovastatin, as cholesterol production in the liver is more active at night. Others, like atorvastatin and rosuvastatin, can be taken at any time. Check with your doctor or pharmacist. Another important point is the potential link between statins and type 2 diabetes. Research indicates that prolonged use might increase the likelihood of developing diabetes by up to 50%. This is a troubling trade-off because diabetes itself is a major contributor to heart disease. Beyond that, cognitive issues have been reported by some users. Memory lapses, confusion, and difficulty concentrating are among the symptoms that can impact quality of life. While these effects are usually reversible, they're still a challenge for those affected. That being said, statins can be life-saving for individuals with a history of heart attacks or serious cardiovascular conditions. For these patients, the benefits typically outweigh the risks. But if the primary issue is high cholesterol with no additional complications, it's worth considering alternatives first. Adopting a heart-healthy lifestyle can often provide powerful results. A balanced diet filled with fruits, vegetables, whole grains, and healthy fats is a great foundation. Regular physical activity, even just walking or light exercise, works wonders for cholesterol and overall health. Stress reduction, weight management, and avoiding smoking are equally critical for protecting the heart. These steps are not only effective, but also come with benefits that extend beyond cholesterol control. One of our friends, Laura, had a story that really stuck with us. She's someone who's always been health conscious. You know the type. Laura loved her yoga classes, prepped meals with organic ingredients, and made time for long walks every evening. But a few years ago, during a routine checkup, her doctor told her something that left her feeling uneasy. Her cholesterol levels were higher than they should be. At first, Laura didn't think it was a big deal. She figured she could tweak her diet, exercise a bit more, and things would even out. But during her follow-up appointment, her cholesterol was still elevated. That's when her doctor recommended statins. She left that appointment with a prescription in hand and mixed emotions swirling in her head. At home, Laura decided to do some research. She read about the benefits of statins, like their ability to reduce the risk of heart attacks and strokes. But she also discovered the potential downsides. Stories of muscle pain, fatigue, and even an increased risk of diabetes made her pause. The part that really caught her attention, though, was how the statistics were framed. Laura read that statins might lower the relative risk of a heart attack by 30%. That sounded great until she learned what it actually meant in absolute terms, a reduction from 3% to 2%. To her, that didn't feel as significant as it initially sounded. She kept wondering, am I the one person this will help, or one of the many who might take it without seeing a benefit? Still, she wasn't about to gamble with her health, so she decided to try the medication. For the first few weeks, things seemed fine, but then she started to notice subtle changes. Her legs felt heavy after her usual walks, and simple tasks like climbing stairs left her more fatigued than normal. A few months later, she began experiencing sharp pains in her calves that wouldn't go away. Laura went back to her doctor, who confirmed that her symptoms could be side effects of the statins. Together, they discussed her options. The doctor emphasized that statins are essential for some people, especially those with a history of heart disease. But in Laura's case, it might be worth exploring alternatives. Determined to take control of her health, Laura made some serious lifestyle changes. She revamped her diet, focusing on whole, plant-based foods. Avocados, nuts, and olive oil became her go-to sources of healthy fats. She cut back on processed foods and refined sugar, replacing them with colorful vegetables and lean proteins. Laura also stepped up her exercise routine. She didn't do anything extreme, just consistent effort. Morning jogs, strength training a couple of times a week, and regular yoga sessions became her new normal. To manage stress, she added meditation and journaling to her daily habits, finding that they helped her feel centered and focused. 6 months later, she went in for another checkup. Her cholesterol levels had dropped significantly without medication. Even her doctor was impressed. Laura felt stronger, more energetic, and healthier overall. But she didn't stop there. She kept up her habits, realizing that this wasn't just about cholesterol. It was about creating a lifestyle that supported her long-term well-being. Laura's story is a reminder that medications like statins have their place and can be life-saving for some people. But for those without a history of heart disease, it's worth looking at the bigger picture. Sometimes, lifestyle changes can be just as powerful as a prescription, and they come with benefits that ripple through every part of our lives. Her experience also shows how important it is to have open conversations with healthcare professionals. By understanding our unique risks and exploring all options, we can make choices that align with our goals and values. In the end, Laura's journey wasn't just about lowering cholesterol, it was about taking charge of her health and finding a path that worked for her. And that's something we can all learn from. What's the takeaway? Every choice about our health should be informed. Before starting or stopping statins or any medication, it's vital to consult a healthcare professional. They'll help us understand our personal risks and benefits, ensuring we make decisions tailored to our unique needs. Health is a journey, and being proactive about the steps we take is empowering. Let's focus on understanding our options, staying informed, and choosing paths that work best for us. Together, we can then make decisions that keep our hearts and our lives healthy and strong. Number 3, sleep medications, Zolpidem. Let's talk about something many people reach for when sleep just doesn't come naturally. Sleep medications, like Zolpidem, also known as Stilnox or Ambien. These meds are often prescribed to treat insomnia, and they do work quickly to help you fall asleep. However, the long-term use of these medications can come with serious downsides that we need to consider. First off, if used for extended periods, Zolpidem can lead to a variety of issues like dizziness, daytime sleepiness, and even unusual behaviors. Some might find themselves having strange conversations or forgetting things they did. This is particularly risky for older adults, where the chances of falling increase drastically. And let's not forget, the longer we rely on these meds, the higher the chance of developing a dependence on them. One of the biggest problems arises when people stop taking them abruptly. It's not just about getting a bad night's sleep. This can lead to rebound insomnia, making the problem even worse. We all know how frustrating it is to feel anxious about not sleeping, and this anxiety only adds to the insomnia, creating a vicious cycle that's hard to break. Now, we don't want to rely on these medications forever. Instead, there are natural, healthier ways to improve sleep. Simple behavioral changes and sleep hygiene practices can make a world of difference. For example, only going to bed when you actually feel tired, steering clear of screens before sleep, and keeping a consistent wake-up time, even after a bad night's sleep, can work wonders. Incorporating calming activities like reading or meditating before bed can also help set the stage for restful sleep. Another point to consider is the quality of sleep. While sleep meds like Zolpidem may help you drift off faster, they can interfere with the deeper stages of sleep, like REM sleep. As a result, you might wake up feeling just as tired as you did when you went to bed. That deep, restorative sleep is essential for feeling refreshed and recharged, and sleep medications often disrupt that natural process. And it doesn't stop there. Sleep medications come with potential drug interactions too. Many of these drugs are processed by the liver, meaning they can mix poorly with other medications, alcohol, or even certain foods. This can amplify the side effects and risks, making things even trickier. We also need to remember that insomnia might not always be a standalone issue. Often it's linked to underlying conditions like anxiety or depression. In these cases, tackling the root cause can be far more effective than relying on sleep meds. Cognitive behavioral therapy, CBT, has been shown to be highly effective for treating insomnia, helping individuals change the thoughts and habits that contribute to poor sleep. Finally, let's not overlook other ways to improve sleep quality. Creating a peaceful, quiet environment for sleeping, getting regular physical exercise, but not too close to bedtime, and cutting back on caffeine and alcohol can have a big impact. Managing stress through practices like deep breathing or yoga can help calm the mind before bed, setting us up for better sleep. Of course, if insomnia persists, it's always a good idea to seek professional advice. In some cases, sleep medications may still be necessary, but it's crucial to carefully weigh the risks and explore other options that offer longer-lasting benefits. We all deserve restorative sleep without relying on medications that could do more harm than good in the long run. Number 4, diabetes medications, SGLT2 inhibitors. Let's talk about a type of medication that we should really think carefully about when managing type 2 diabetes, SGLT2 inhibitors. These medications help lower blood sugar by forcing excess glucose to leave the body through urine. Sounds good, right? But like anything, there's a catch. While these drugs can be beneficial in certain cases, they come with a handful of risks that shouldn't be overlooked. For starters, they increase the likelihood of urinary and genital infections, especially in women. This is something to keep in mind, as infections can be uncomfortable and, in some cases, even dangerous. On top of that, the increased loss of glucose can lead to dehydration and fatigue. We're talking about feeling weak, drained, and lacking energy over time. Now, don't get us wrong. SGLT2 inhibitors have their place, especially for people with diabetes and other conditions like heart or kidney disease. But before jumping straight into medication, it's worth exploring lifestyle changes. Managing blood sugar through diet, exercise, and maintaining a healthy weight should always come first. These changes can sometimes be just as effective, if not more so, than relying on long-term medications. But there's a bigger issue we need to highlight here: diabetic ketoacidosis, DKA. This is a serious condition where the body produces dangerous levels of ketones due to low insulin. Though more common in people with type 1 diabetes, it can also happen in type 2 patients who are on SGLT2 inhibitors. The signs of DKA include nausea, vomiting, abdominal pain, confusion, and even shortness of breath. If not addressed immediately, it can lead to coma or death. That's how serious it can get. Another concern? SGLT2 inhibitors have been linked to an increased risk of amputations, especially for people with peripheral artery disease or diabetic neuropathy. It's critical to keep a close eye on your feet and legs while on this medication. Any cuts, wounds, or infections should be reported to a doctor right away to avoid complications that could result in severe consequences. Now, here's the good news. For many people with type 2 diabetes, lifestyle adjustments are the game changer. A healthy, balanced diet, regular exercise, and even losing a bit of weight can make a huge difference in blood sugar control. It's not just about the numbers. It's about feeling better, more energetic, and empowered to take charge of your health. When lifestyle changes aren't enough, we've got other options to consider before jumping to SGLT2 inhibitors. Metformin is typically the first medication doctors reach for. It's proven, safe, and well tolerated by most patients. So before going straight to SGLT2 inhibitors, let's take a step back and explore what's available. Taking a balanced approach to managing type 2 diabetes is key. Stay informed, take control, and remember, small lifestyle changes can lead to big results. Number 5. Proton pump inhibitors, PPIs. Let's talk about proton pump inhibitors, PPIs, a medication many rely on to manage acid reflux or stomach ulcers. Commonly prescribed drugs like omeprazole are designed to reduce stomach acid production, offering relief from reflux and helping heal ulcers. But here's the catch. Prolonged use can cause more harm than good. When taken over long periods, PPIs can lead to some serious health issues. They're linked to vitamin B12 deficiency, which is crucial for nerve function and blood cell production. They also interfere with the absorption of key minerals like magnesium, calcium, and iron, all of which are essential for bone health, energy, and overall well-being. This can put us at risk of developing osteoporosis, and for some, the dangers extend to an increased likelihood of gastric cancer. But that's not all. PPIs can weaken the stomach's natural defenses, making it easier for harmful bacteria and pathogens to enter the digestive system. In fact, studies show that long-term use of PPIs could even increase our vulnerability to pneumonia. The risks don't stop there. We might also find ourselves more susceptible to infections like Clostridium difficile, a potentially life-threatening bacterial infection that causes severe diarrhea. This happens because PPIs upset the delicate balance of bacteria in the gut, creating an environment where bad bacteria can thrive. Now let's think about alternatives. Drinking water can actually offer temporary relief from acid reflux, much like those medications. It's a simple step, but effective. Instead of leaning on PPIs long-term, why not address the root causes of reflux? Factors like being overweight or poor dietary choices can contribute to acid reflux, and tackling these lifestyle habits can reduce or even eliminate the need for medication. The good news is, making changes in our daily habits, such as losing weight, improving our diet, and reducing stress, can work wonders for many people when it comes to managing reflux. It's not just about popping a pill. It's about giving our bodies the right tools to thrive. Another thing to keep in mind, PPIs can interfere with other medications we may be taking, including blood thinners, antidepressants, and osteoporosis treatments. These interactions can lead to serious health complications, especially for older adults or those with multiple health conditions. So it's important to think about the bigger picture and talk to a healthcare provider before relying on PPIs long-term. Finally, it's essential to remember that PPIs can have their place in treating specific conditions, such as stomach ulcers or erosive esophagitis. However, they should never be a long-term solution without regular medical guidance. If reflux symptoms continue despite lifestyle changes, consider exploring other treatment options, like H2 receptor antagonists or antacids, before turning to PPIs. If PPIs are necessary, it's important to minimize their use as much as possible. Always ensure proper monitoring to avoid potential risks. And if you decide to stop taking PPIs, do so under medical supervision. Abruptly stopping can actually make reflux worse by causing a rebound effect, increasing stomach acid production. The key takeaway: PPIs can be a helpful short-term fix, but they come with significant long-term risks. It's crucial to explore healthier alternatives and minimize dependence on these drugs whenever possible. When it comes to health, addressing the root causes is crucial. Too often, we rely on medications to mask the symptoms, but that's not the solution. Sure, medications are necessary in certain situations, like after a heart attack or for those at risk of kidney failure. But in many cases, making simple lifestyle changes can be a game changer. We're talking about adjusting our habits, focusing on what we eat, how we move, and how we manage stress. These small shifts can lead to long-lasting improvements. At the end of the day, our health is in our hands. And while meds might be a part of the journey for some, it's the lifestyle changes that make the biggest difference in the long run. We really hope you found this conversation helpful. If you did, don't forget to hit that thumbs up button and subscribe for more valuable tips.